Good morning and welcome to COVID-19 Talk with Local Health Authorities. Joining me, representing Harris County, is Dr. Erica Brown, representing the City of Houston, Dr. David Purse. Special thanks to David Castillo and Priscilla Key, our co-producers, and Kathy Finninger, past president, Rotary Club of Houston, who has been putting all of these questions together for almost 2 years now. I'm Stephen Williams, director of the City of Houston Health Department. Looking at Harris County Hub, new cases are up to threat level 1. How is the status determined? An average of all indicators. CDC just upgraded Harris County to high threat level. What are the implications?
So I'll take that one. Good morning. So the CDC weekly metrics used to determine the COVID community level are case rate per 100,000, and we are currently at 211.89. High indicator is greater than 200, so we're just over that threshold. New COVID admissions per 100,000, and ours is at 12.4, and the high indicator is over 10%. And then staffed inpatient beds in use with a confirmed COVID case, we're at 4.4, and the high indicator we haven't met, which is greater than 10. So the reason we've moved is because we've met 2 out of the 3 indicators. But I would like to frame that a little bit and say, even though we've met 2 out of the 3 indicators, we still are nowhere near where we were when we saw the previous waves of COVID infection.
Are hospitalizations going up?
So I'll take that one. So as Dr. Brown pointed out, you know, the metric for hospitalizations is going up, but it's not going up at the same rate as some of the other metrics are. So we are seeing an increase. And the other thing to keep in mind is that as the virus is spreading through the community, people who are being admitted to hospitals for other ailments are going to incidentally have infection with COVID. So there's part of that going on. But in addition, I will say that, you know, the metrics we look at, just look at the number of patients who are admitted with, you know, with COVID, whether it's with COVID or for COVID, it's all looped together. But I will say that anecdotally, talking to my colleagues who work in emergency departments, they are definitely admitting more and more people over the last several weeks because of COVID. We hadn't seen that in a while. So that's starting to tick up. But again, to reinforce what Dr. Brown said, it's nowhere near the levels that it was previously. But things are moving in that direction, at least for now they are.
Thoughts on the almost 25% positivity rate? How do at-home tests figure in?
So at-home tests have really become a great tool to help mitigate spread in terms of being able to test yourself without coming out into the population. However, we don't have a very good mechanism of recording that test result. So Public Health has a site on their website where you can put your test result in, but other than that, we really don't know how many positives we've had out of the at-home test. So the number of positives in the county is surely higher than we're reporting because we don't have that information.
Wastewater update, Purse.
Yeah, so the wastewater, the amount of virus found in the wastewater is continuing to go up. We're at about 552% of the July 6, 2020, the peak of the first wave. We made that an arbitrary 100% value. So we're 5 times higher than that. And that's up from just a little bit over 500% the previous week. So it's about an 11% increase week over week. Now that's, you know, it's going up, but again, in the previous weeks, we had seen a 30% increase, and in the week before that, it was about a 50% increase. So it's still increasing. The rate of increase is leveling off a little bit, maybe. So that's good to know. But there's plenty of virus in the community, and it is spreading. Is the bottom line there?
Would a national public health system assist in eliminating the lack of communication amongst federal, state, and health organizations?
So I found this question interesting. We have a national public health system. It's called the CDC. So the way it flows is from county to state to federal. Federal is the CDC. I think that perhaps there's a perception there that we may not, because there's so much information flowing in from so many different levels, as it should be. And sometimes there's a lag, and sometimes, you know, just again, across the country, you can imagine how difficult it is sometimes to synthesize everything in a timely manner.
And I think with COVID, things were just changing rapidly, and people got the impression that there was either a lack of communication or folks didn't know, and there were a lot of things that were unknown. So I just think that we just have to embrace that fact. What do you think about working out in a gym now that there's no mask mandate?
Yeah, so this sort of fits in with a lot of the things we've said before. So there is risk going to gyms. The CDC has actually published a couple of papers that have been done or in the literature looking at the spread of virus in the gym, and there is more spread in gyms than some other places, and that's not a big surprise. People are they're huffing and puffing, right? And so if they're infected and they don't know it, or they're infected, they got minimal symptoms, and they don't think they have COVID. Either way, when they go in there, they start breathing heavily and huffing and puffing, and coughing and what have you. That increases the spread. Now, that having been said, I will tell you that I go to the gym. I go to the gym almost every morning, but I go from 5 till 6 in the morning. The gym opens at 5. I'm there for the first hour it's open. There's hardly anybody there, although there's more people than I'd expected. And even within the gym, I can find ways of keeping myself socially distanced from others. So you can go to the gym, but you got to be smart about it. And on occasion, there are some people in the gym wearing masks. They tend to be elderly folks, but you can go to the gym and wear a mask. I would advise you wear an N95 mask to protect yourself. But yeah, the gym is a high risk place to go.
Symptoms status testing. Are there any differences in this variant symptoms?
So it's not confirmed, but we are seeing some slight differences. So for instance, in the previous variants in Alpha and Delta, more people lost taste and smell. And that, in fact, is how some people identified that they perhaps had COVID. What we're seeing with the Omicron variants are less severe symptoms, more cold-like symptoms, upper respiratory symptoms. But that doesn't mean that you can't have, and we have not seen all of those symptoms with all of the variants.
So Omicron's been around quite a while now, hasn't it?
It has. It's been years, actually. It's crazy. It's been years.
Can you go over the isolation recommendations if you're up to date on your vaccines but still test positive?
Yeah, so I'll take that. So if you test positive, you should stay home. You should isolate yourself at home. And that means really isolate yourself from your family members. Remember, the person you're most likely to infect is a family member. So isolate at home for a minimum of 5 days. Now, if at the end of the 5 days you've been fever-free for 24 hours and whatever other symptoms you have are improving, you can then end your isolation. Now, some people don't have symptoms at all. They test positive. So the people without symptoms, they still need to isolate for 5 days. And then the other caveat is that if you get sick, like really sick, maybe not requiring hospital, certainly if you require hospitalization, but even if you get really sick at home, or you've got a weakened immune system, then you should isolate for about 10 days because your immune system is not fighting it off as well as somebody with a better immune system. So you're likely to be contagious for longer than just the 5 days. So in that case, you should isolate for 10 days.
How long can you test positive on an antigen/at-home test?
Great question. So typically, let's talk a little bit about the difference in the home test and the one that you get from the office and get sent off. You don't get a result back immediately. So the antigen test is meant to test for acute infection, meaning if it's positive, you are acutely infected, you have infection now. So that typically can last up to 14 days. But it can be a little bit longer. So usually, though, it lasts only as short as a week or so. So previously, people were going back and getting retested for their job to go back to work. And you would notice that most people were negative when they got a retest. So it's typically 7 days, but it can go as high as maybe 14 days. The PCR test, which takes a look at have you been exposed and mounted some response at some point in time to the COVID variants, that can last for quite some time. And so you can test positive on the PCR test for months after, but not be currently infectious.
Science.org article indicates that immune boosting by B1.1.5 Omicron depends on previous SARS-CoV-2 exposure. Please explain.
So I'm not too familiar about the article, so I just have a few cliff notes. But it appears that the article is proposing that if you have had Omicron infection in the past, it may boost your immunity. But the data apparently is showing that may not be the case. So that was the question. Does it boost your immunity? The data is showing that may not be the case, specifically with Omicron, whereas with previous variants, that was the case, where the data was showing that if you had been previously infected, there was some boosting of immunity.
The virus seems to be changing multiple times a year. Does that predict a future of multiple vaccine regimen each year?
Yeah, so this is a good question. You know, one thing to keep in mind is that this is an RNA virus, which means it is more easily, more prone to mutation. And that's not going to change. It's going to, so as compared to some of the DNA viruses, for example, you know, monkeypox is making a lot of news. That's a DNA virus. That doesn't mutate very well because there's two strands that would both have to mutate in exactly the right way. So I think that we can expect continued mutation, and much like the seasonal flu, that mutates every year. And so, yeah, we are probably, it's not unreasonable to expect that we'll wind up in a situation like the flu, where every year there would be a slightly different vaccine to protect you against whatever strain of COVID is circulating the globe that year. That could easily happen, yeah.
Okay. Is it true that vaccinated people are less likely to develop a fever as a symptom of COVID? If that is the case, why are some locations still focusing on checking temperatures to enter a building?
Yeah, so that's a good question. And actually, it's not just fever, but if you've been previously, if you have immunity previously, whether it be from vaccine or from a previous infection, for most people with a subsequent infection, we anticipate that your symptoms may be blunted a little bit. So you would have less fever, you may have less body aches. It really goes to whatever you're infected with, how different is that from what your previous immunity was, right? So if somebody gets infected with Omicron and their last infection was the Alpha variant early on, they may get full-blown symptoms. Whereas if you get a Omicron infection now and you were also infected with Omicron a couple of months ago, then you may have much milder symptoms. And to the point of the temperature testing is that, yeah, that has operationally, we found that didn't necessarily provide the level of protection we originally thought it did. So some places are still being very conservative, and I don't blame them for doing that. But it is a good question as to whether or not that's actually serving the purpose it was intended to.
The CDC says pregnant people who become infected are significantly more likely to need intensive care and to deliver babies prematurely. Have there been enough studies to prove this?
So no, the second part of the question, we're still learning about COVID just in general, okay? Because we're still fighting COVID. But yes, the data is indicative that pregnant moms who are immunocompromised, which is a group of people that we've been talking about all along, are at higher risk. Pregnant moms are at higher risk. And so, yes, we are seeing some of that in the data, but it has not been proven out yet.
I know it's the right of a parent to determine whether the children should receive vaccinations. Have you heard of any options for a child who is stressed about being left out of activities with friends because parents refuse to permit vaccines?
So this is the emotional impact of the pandemic on kids as well as adults has been remarkable, right? And there's lots of issues to this particular question. It is the right of the parent to determine whether or not their child can get vaccinated. And for most kids, unfortunately, that's a discussion to be had in the home, and there's not a lot of options. And so I don't have a good answer for those kids. Now, when school is in session, there are counselors and stuff where kids can go and get mental health, and mental health support. And for any kid who's struggling with any sort of stressor, I would ask that they reach out, because we see a lot of other mental health impacts completely aside from COVID, that kids need to understand that there are people who care about you and there are options available. Just the impact of social media and bullying and all that, very real, very problematic. And so reach out to the resources available to you, most commonly through kids groups and your schools.
How long does it take to develop an immunity post-COVID?
Yeah. So your immunity develops almost immediately. So when you're ill and your immune system is responding, you're producing antibodies, and that's really what happens, and that's what gets rid of the infection. So you've got antibodies. Now they remain in your system for 3 to 6 months. So you've got immunity. As soon as your symptoms are gone, you've already got some level of immunity.
Bivalent vaccine news.
So bivalent vaccines, let's talk about what they are first. Bivalent vaccines have antigen to more than one variant, okay? So we're seeing different variants, coming up in different ways. We're now in the Omicron and its subvariants. And so bivalent vaccines will be helpful as the virus continues to mutate. As David said, that's something that's going to happen because it's just a normal progression of an RNA vaccine, or RNA virus rather. So Moderna recently announced that they were working on a bivalent booster. And so the CDC and FDA are looking at that, and the hope is that something will be out by the fall.
Kids under 5 can finally be vaxxed. Should I do it now or closer to school starting? Do you have any concerns about vaccinating little ones? What should I consider?
Yeah, so this is a great question. It's a complicated question. So first of all, I would encourage parents who want their kids to get vaccinated to go ahead and do it now, and for a couple of reasons. One is, it's whether you get the Moderna, that's a 2-shot series. If you get Pfizer, that's a 3-shot series, and so you want to get that ball rolling now, so that by the time school starts, your child has immunity. The other thing in terms of concerns, I really don't. Now, with Omicron, we actually saw, and I'm talking about this last, January, February region, with that wave, we saw a huge number of kids getting infected, which we really hadn't seen with the previous waves. And there are over 440 children have died in the United States from COVID. And, thousands more were admitted to the hospital. About a third of the kids who were hospitalized had no pre-existing illness. Between a third and a half had no pre-existing illness. So parents who think that, well, I only really need to worry about if my kid has a long-standing illness, my kid's healthy, I probably don't need to worry about it. Most kids do fine. Remember, a lot of the kids who got admitted had no previous illnesses, and a quarter of all the kids who got admitted wound up in the intensive care unit. So for the kids who become sick, they become very sick. And like I said, we've had over 400 kids who died. So I would absolutely lean forward and get my child vaccinated. I'll tell you, my daughter's 25, my other daughter's 40. We got 3 grandkids. They're all vaccinated. There's no question.
Which vaccination do you recommend for my 6-year-old? Higher protection versus more severe symptoms?
So for both 6-month and 6-year-olds, both Pfizer and Moderna are available. So I really don't have a specific recommendation on either one. They both have great efficacy. It really just depends. So for Pfizer, as David spoke to, Pfizer is a 3-dose series for our infants to 5-year-olds, and Moderna is a 2-dose series. But it really just depends on your preference and what's available at the location that you go to. I don't have a specific preference. I don't know, David, if you had anything more to say about that.
No, I really don't. The biggest difference right now is that, one is a 2-shot series, the other is a 3-shot series. There's the studies that are out have shown that they're safe. Now, admittedly, there are those who are complaining that the number of subjects in the studies was relatively small, and that's true. But what they have shown, or what they have seen, is that the younger kids. There was a lot of talk about the teenagers having problems with myocarditis. Not seen any of that with the pre-teen kids, and we don't expect it. So I have less concern and more confidence in these vaccines, perhaps, than we had a little bit of a surprise with that myocarditis. And even with the myocarditis, for the parents of teens who were still saying, the vast majority of those kids did absolutely fine, and it was really, really rare. And myocarditis happens otherwise in kids, completely aside from COVID and vaccines. And kids who get infected have a higher risk of getting myocarditis from the infection than they did from the vaccine. So there is no zero risk option. I think that's the bottom line. If you're looking for the zero risk option, there is none. Your child's either going to get infected with the way this is spreading like crazy, or you can protect them with vaccine. So it's kind of a no-brainer from my standpoint.
FDA EUA to Pfizer and Moderna for infants, toddlers, and preschool kids. I'm weighing the 2 versus 3 shots time to be vaccinated.
Yeah, I think that's kind of what we just talked about. Is it's, you know, that if you go Pfizer, it's going to take a little bit longer. Well, a couple of things. Well, if you go Pfizer, it'll take a little bit longer to get fully vaccinated. The other thing is Moderna is looking at the impact of a 3rd shot. So I won't be the least bit surprised if in a couple of months we find out that the Moderna is actually a 3-shot series as well. That wouldn't surprise me.
Changing the subject on us. The WHO says monkeypox is real risk to public health. Now that we have a case of monkeypox confirmed in Houston, how concerned are you? How does it spread?
This is something we the colleagues just discussed this morning. Right now, there is not a high risk of spread of monkeypox. The reason that we're even discussing is because there's no risk. There is some risk, but there's not high risk. And in order to not move along the continuum to high risk, it's important that we educate the community about what it is, how it spreads, and what we can do to mitigate the spread of it, so that we don't get to a point where it does become of concern. I'm going to take something Dr. Peirce said earlier. There are many more things that are much more common that will happen in the community than monkeypox, but obviously it is happening. So the second piece about how does it spread, monkeypox is spread through direct contact. So that may be intimate contact, that can be contact with linens and bed sheets from someone who has the rash, and the rash may be weeping, etc. But it is spread through some direct contact. Signs and symptoms can be what we would call a prodrome of fatigue, fever, lymphadenopathy, where your lymph nodes are a little bit swollen, just generally not feeling well, which progresses onto the rash. And sometimes people totally miss the prodrome, and the first sign of it for them is the identification of the rash. The rash can be in different stages as well. It can be pimples, it can be blisters and vesicles. Some of them can be scabbed. So the key is this: be vigilant about it. It is rare. So there are a lot of other things to consider before we say this is something, jump to, oh, I think I have monkeypox. But at the same time, be vigilant about it. Specifically for those who are international travelers, okay? Specifically for those who are in the LGBTQ community as well. Be vigilant about it. If you develop a fever, if you develop an unknown rash and it looks like pimples, it looks like vesicles, sometimes in the genital area, but other times as well can be in other areas. The key is just to go get checked out. The likelihood of it being monkeypox is still very low. It's probably something else, but just go and get checked out by your local provider.
Is there a PCR test for monkeypox?
Yes, the test that we use, it's a 2-step process, but it is a PCR, which means it's highly accurate. But it is PCR based, yes.
Okay, we're changing. What is the latest on bird avian flu?
So the stats, as of what I have as of June 14th, so about a week or so old, it's been detected in about 1,500 birds with 42 states, and 393 counties have been affected. In terms of severe illness and death, though, there really hasn't been very much severe illness and death. The last reports for Texas were in May, and so we're now almost out of June. So that doesn't mean that we're not still watching. But the threat seems to be decreasing a little bit, at least in our area. And I knock on wood for saying that, because usually that means I'm bringing something back. So I want to rescind that statement. So currently transmission is obviously from infected birds to people. But again, the key is here that the risk is fairly low, and we have not seen any reporting in our region since last month. I don't know, David, if you had anything you wanted to add.
No, that's exactly right. This happens pretty much every year, and so far the transmission to humans has been extremely low, and let's hope that it stays that way.
Is there any concern on transmission in food?
So with influenza, no, but perhaps this question is going really towards monkeypox.
Yeah.
And in the United States, no, I don't think there's any concern about transmission in food. We do hear that people in Africa who live in the jungle contract monkeypox because they eat what's called bushmeat, which is really just the meat of the animals in the jungle. But here in the United States, I don't think there's any concern for transmission through food. No.
Is flu season this year predicted to be mild?
We don't know yet. Flu season is a little bit funky this year in terms of just what we're seeing. So obviously we had COVID infection. Flu season seems to be going a little bit longer than previous, but I wouldn't say that the number of cases are unusually high this year. So I think the key is we're just still watching. And we have had some people who are still developing the flu, and we'll continue to monitor.
Is it too late to get a flu shot?
Almost. So I can speak for public health. So a few things, again, you have to base this off of what we traditionally know. As I said, the flu season is going a little bit longer. We base the flu shot on the traditional flu season. So traditional flu season, we start in August and we go all the way to April or so. Mind you that, as David said before, the immunity typically for a flu vaccine is about 6 months. So it probably at this point, the new flu vaccine for this coming year will be out in a few months. Does it hurt you to get a flu vaccine? No, but I don't know that everybody has flu vaccine anymore, because the new ones have even been ordered and are on their way.
Okay, thank you. Thank you for joining us for COVID-19 Talk with local health authorities. Dr. Erica Brown, representing Harris County, Dr. David Purse, representing the City of Houston. Special thanks to our producers, David Castillo and Priscilla Key, and past president of Rotary Club of Houston, Kathy Feniger, who provides us with these questions. I'm Stephen Williams, the director of the Houston Health Department.